Asthma Allergy Center's Dr. Giri Dandamudi. Dr. Dandamudi, welcome back to the show.
Nice coming back again.
We were talking just a few minutes ago before the show about allergies because the host of this show thinks he might have allergies, and Dr. Dandamudi is not so sure.
Yeah, because you never had this problem before.
Right.
So you went to Florida. Most likely you got a flu bug or something. And like anybody else, you were tested for a COVID, and it was negative. So you also had H. pylori, then that causes some acid. Sometimes that acid can reflux and feel something in the throat, and people feel something. It could be both of them.
I could have a range of things.
Yeah. I doubt it is allergies.
Yeah, and I think that's the first thing people say. Oh, well, it's got to be allergies because, everything's in bloom, right? But this is the time when seasonal allergies are most prevalent.
Yes, the tree pollens. So early spring, this is the time. We are getting into the summer. So April and late April through May is the tree pollen season. For any given tree, it is only a couple of weeks, the pollen. And when you see the leaves are coming, then probably the pollen is over. Then now, you see the grass pollen. May and June is the grass pollen most severe. And then it eases a little bit in August and September, you get the ragweed pollen. So ragweed pollen. That is, once it is frozen, then you don't have much of an outdoor thing. Then you have indoor allergens. The most indoor allergen is always the pets. The cat, dogs, that kind of thing. And everybody loves their pets, and then that keeps me busy. Yeah.
Somebody told us about a non-allergenic pet a couple weeks ago. What was that, Brendan? A Dandamudi or a Labradoodle, or what was it?
Yeah, I don't remember.
It was some combined.
It tells you one thing, they love their pets so much, they call it as a non-allergenic. There's nothing like a non-allergenic pet. Any protein molecule can cause an allergy in the population that are more prone. So the cat saliva, dog saliva is a protein, dog hair is a protein. Any protein can trigger off allergic reaction. But some proteins trigger less allergy than the other breeds. So that is a less allergenic than is not a non-allergic.
No such thing, non-allergy pet. So one of the things we want to talk about today, here we are 2 years and 2 months into the pandemic. And over the course of your visits, we've talked a lot about what we're learning as time has gone on. Are there some things we did not learn? Here we are 2 years into it, and we have not learned a lesson about what?
See, one of the things in general, it happens to anyone. If you don't know, everybody could be right. So that is the approach. So the CDC doesn't know, the government doesn't know, I don't know, nobody knows what is going on with this one. So when you don't know, you respect everybody's views. So when that doesn't work, you use your common sense. That's where the common sense approach. I think one of the common sense approach, it was lacking, the whole thing is telling you go and talk to your doctor. That never happened, the whole process. The process was like this. If you think you get infected, stay home and go to the hospital. So they completely eliminated the outpatient doctors from this whole treatment protocols. Maybe there is a treatment, maybe there is no treatment. So you have to use the complete medical community, not hospital-based physicians, to do something. And they eliminated that.
And primary care family physicians, they were all left really in the dark because not only were people discouraged from visiting their doctor, the doctors were kept out of the loop on treatments and care, and they were told to just shut the doors too, right?
That's exactly. They just, it's like you got a car problem. You tell them, go to the internet, don't go to your mechanic. That's the biggest mistake as far as I'm concerned. The second thing is, once they go to the hospital, some of the nurses are telling me, doctor, we didn't do anything, we just pushed a button. Protocols.
Mm-hmm.
I can understand that there's so many sick people there. There is no individual treatment. So COVID protocol, everybody got the same medication. Everybody is male, female, what age, it doesn't matter. Everybody got the protocol. So we know that how much of money is wasted on this antiviral remdesivir, and we know now it never worked. It never worked. And it was never, even today, I don't think it is taken off the protocol.
But there are people that will still swear that remdesivir was an effective treatment because it was being used. It was being administered. People were talking about it. The FDA, people were investigating it. It was out there.
Yes, but any antiviral doesn't work, unless you use it very early. The antiviral is always, even a flu also, you have to use it very early. So most of the people who go there, it is 2 weeks into the virus. 2 weeks into it. So, and also the people are dying because of the inflammation, not because of the virus. So even if you can, take care of 25% of the viral load, what it makes? So basically, practical purposes, it is waste of money.
Well, we're starting to see cases rise, and some might wonder, how do we know cases are rising? Because people that are either not testing or they're testing themselves at home, these numbers are not being reported. So we really don't have a handle on what the state of the pandemic is, do we?
As I told you before, as far as I'm concerned, the COVID situation is over like in the spring, like in March or February, the last time I was here. Why? It is a manageable disease now. Doctors are treating with a early dose of steroids and whatever there. So it is a manageable disease. Whenever there is a manageable disease, you need not screen everyone. I don't know. It's my personal opinion. I really don't know why we are all, still screening the patients. It is a manageable disease. Let it spread. Let us manage. We can manage it. And these are all immunized patients. I think, as I told you before, wearing a mask is a very good thing. Social distance is a very good thing. Getting vaccinations, a lot of people are vaccinated. They're protected. Vaccines is one of the best things that happened. And there's the other day I was asking with my friends, why China? Why there are still so many cases in China? Well, again, we don't know. When you don't know, everybody's opinion is right. So my opinion is, I really don't think their vaccines are as good. That's my, I don't, maybe I'm wrong. They never tell you what vaccine they have. Our vaccines are very effective,
But we're still, some 30% of people aren't vaccinated at all. So that's a lot of people still to get sick. And we don't know if you've had it, if you can get it again. But I've heard people have had it more than once or twice.
Yes, these variants are going to come. It's a virus, it mutates, and they will stay for a long time. And then, then looking back, when the COVID started, I think, again, this is my opinion, it started probably a months and months before that we start seeing the cases. Months and months, maybe a year before that. It was going on, and then there's a load came in there. There are so many people who are sick. That's why it was affecting mostly the nursing homes.
I think you're right, because I know people who were sick, which in retrospect had COVID-like symptoms back in fall of 2019, And this was before Wuhan or anything else.
Yes.
So do we know? We don't even know if Wuhan was actually the epicenter of the virus.
It probably even there also, it was there for a while. So it got that one in there, yes.
Should we be doing more in the way of investigating the actual origin of the virus in terms of protecting us from whatever's next?
Well, there's a stone wall now, nobody knows, nobody's talking about it. You know, I don't know. And why we are not trying to find out where it started, why it came. And this is the first time with all the other viruses, at least somebody is looking at them. And somebody is, all of a sudden, we don't know. We don't know where it came in there. We don't know when it started. You know, what we know is people are dying. You know, and also we know it is an inflammatory problem, that is vasculitis, that is killing the people. And we know the steroid works.
That was an early treatment.
Yes. The only thing, steroids works for inflammation, but only controversy is don't treat them until they go to the hospital. So for me, I will treat them very early to prevent their hospitalizations. So that is my opinion.
Because you know it works because you did it.
Many patients I treated. But always, not only steroids, you have to follow them very closely. You know, make sure that they are on some anti-clot medications. Make sure their pulse ox is monitored, and make sure that there are they don't get a secondary infections. So these are all the things you have to monitor the patients very closely at home, and then steroids is a part of it.
And we still think that, or we have been told that it started from animals in China, but we're still slapping around wet meat on the streets of China. We haven't learned from that. That we're still doing the things that allowed this virus to transmit from animal to human, right?
We don't know. Actually.
We don't know.
We don't know anything. No. But one good news is it is a manageable disease. One. The second thing is most of the doctors are treating with early dose steroids. They are treating like a call it bronchitis. You know, they are giving inflammatory like any other viral infections. They are treating. They are giving steroids as an outpatient now, oral steroids.
So how would you put this on a level in terms of other manageable diseases? Flu, is it like the flu? Is it more like HIV/AIDS? Is it somewhere in between?
No, it's like a flu, more serious flu.
Okay.
Yeah, not more than that. Even the flu every year, there are 60, 70,000 people die every year.
So people are still dying right now from COVID, and that's what happens with a manageable disease like the flu.
Yeah, I think the people are dying still. These are all the people who got infected for a long time. And those deaths are because of the secondary things in there.
But like unlike the flu, there's so many long term ramifications that we don't know about. And long haul COVID, there's people that are still, they're not back to normal.
Yeah, there's no question. If they get pneumonia, if you get a COVID pneumonia, it's a long-term problem. Yeah, so that is the reason why we have to prevent that, if you can, early stage, So if they don't have a pneumonia, they don't have, or a mild pneumonia that is recovered completely, then they should not have any long-term effects.
Masks, we don't have to wear them in the airport or on the airplane anymore. And I noticed yesterday, no one's wearing a mask. No one, maybe 1 out of 300 people. It's a lot easier to wear a mask when everyone else is wearing a mask. I tried, but you lose. I guess you wonder what's the point. Nobody's wearing. Did we drop that too soon? The mask mandate on.
I don't think so.
No.
I don't. I think there's a reasonable people get idea. And I think that's okay. I don't think it's any problem. Even the doctor's office still using it. My office still use it. Then one of the things in my office, at the doctor's office, they're cleaning the tables. Between the patients, cleaning. So I told them, hey, when did we start this? Why you are still doing this one? we know it never spreads from surface to surface. It is all airborne. So why you are doing the cleaning? Then my office manager said, let us stop it. So we don't clean the, if they feel they're okay to clean it, fine. If they don't want to clean it, it's fine. But still we have to wear a mask.
I think we all got in the habit. We bought all up that Clorox and Lysol stuff, and now we've just got a stockpile of it. We're going to use it.
Yes. Yeah.
Well, we appreciate your expertise and your time. Thanks for coming in today.
Thank you.
Nice to see you.
Nice to see you.
Dr. Giri Dandamudi from Asthma Allergy Centers right here in Jackson.